On.
Great. Hey, everyone. Welcome. I'm Scott Cohen from AGP Ventures in Boston, along with David Yahid, based in Renana. Welcome to our latest edition of AGP Access, which is our series aimed at connecting Israeli entrepreneurs to the U.S. market. And thanks to LifeSci for helping to pull this together. LifeSci is a global advisory and investment firm that helps companies with investor relations, investment banking, executive search, and more. We really appreciate their help on this. So by way of introduction, if you don't know AGP Ventures, we're an early stage venture capital firm that invests exclusively in Israeli startups. We're based in Boston and Tel Aviv. And our mission really is to connect Israeli founders to the US market, both through our venture investing and through our commercial go-to-market division, AGP Access. And one of the many ways we try to help Israeli founders is through interactive forums like this, where you can meet and interact with luminaries and experts and decision makers of the Fortune 1000. We've hosted live streams with executives at companies like Apple and Amazon, Facebook, Walmart, Uber, the NFL. And we're honored to have with us today the amazing Eric Thraikill, who's a well-known healthcare executive and industry convener and community builder and digital health investor, and probably more than that. And we're especially happy to have Eric today because there's a wicked storm brewing in his neighborhood with tornado watches and all kind of problems. So if we lose Eric mid-storm, you'll know why. So I met Eric when he was VP and CIO at AmSurge, which is most Israeli companies have probably never even heard of, but they are a operator of more than 200 surgical centers in 34 states. They probably have more physicians at that company alone than there are physicians in all of Israel combined. Israel was acquired by Envision, or AmSurge was acquired by Envision Health for I think like close to $10 billion. And Eric served as Senior Vice President and Head of Business Intelligence and Analytics at Envision. I'm not going to read his entire resume because it's too long and impressive, but he's held VP and SVP and CIO positions at several healthcare companies. He's the chair of Project Healthcare in Nashville, which Israeli founders should definitely know about. We'll hear about today. And most importantly, he's just a great guy, and we're honored to have him with us today. So Eric, welcome.
Thank you. Thank you, Scott, and thanks to you as well, David. It's great to see you again and work together again. I've enjoyed our relationship on a number of different levels.
Ditto. So, hey, everyone. So we run a very informal shop here. David and I are going to throw some questions out to Eric, but our goal is to get your questions answered. So throw them in the chat or text us if you're part of our WhatsApp founders group, and we'll do what we can to get your questions posed. And by the way, if you see me looking down at my phone, I'm not checking my email. I'm actually going through your questions. So keep them coming. So Eric, let's start at the top. You've done a huge amount in your career. But like I mentioned, I'm not sure a lot of the digital health startups on the call are going to even know who AmSurge or Envision are. So tell us a little about those companies and the SVP and CIO roles that you held there, just so folks have some context.
Yeah, sure. So thanks again to you and David for having me here. I'm actually an atypical CIO. I studied accounting at the University of Florida and joined at the time one of the big 8 firms and was with that firm for 11 years. That was Deloitte. And that's the firm that actually got me to Nashville. Being in Nashville, and we'll talk a little bit about this, you're exposed straight away to the healthcare industry and spent my time really learning at a couple of companies prior to AmSurge and Envision, which I joined in 2007. AmSurge was founded in 1992, and if you think about the time at which medical innovation was beginning to occur, where safe, effective surgical procedures could occur in an outpatient setting, it really originated about that time, about the mid-90s, and AmSurge was certainly a pioneer in the business model that they formed with relationships where ownership of an ASC by physician partners is allowable under the Stark legislation. The company started out in GI and then moved to single specialty ophthalmology centers, and then more recently to multi-specialty surgical centers that were generally anchored by orthopedics. And as you can imagine, because of the complexity of a number of different surgical specialties and staffing those with the complexity of the supplies and the nursing staff that's required for each one of those specialties was quite complex and evolved into the more technically challenging operations. And in 2016, as you mentioned, the company was public at the time and then merged with another public company called Envision Healthcare. There was a leader in the staffing of emergency physicians as well as anesthesia and some other specialties like neonatology, primarily in hospitals around the country. And then they also had one of the largest medical transportations, I think of ambulance and life flight vehicles, which was disposed of right after the transaction. Those two companies came together in 2016. In 2018, at the time, KKR purchased Envision Healthcare, as the company was known for at that time, their largest investment in healthcare services, about a $10 billion transaction, and then continued to operate successfully. I will say that the pandemic that obviously commenced right around 2020, significantly impacted that particular company in a number of different ways, and maybe we'll touch on a little bit of that pandemic period itself and a little bit of post-pandemic as we're thinking about healthcare.
So you're located in Nashville, which is, we know is like a healthcare mecca, but I'm not sure most Israelis do. Like, tell us about what's happening in Nashville with healthcare and why. Like, how'd that come about?
Yeah, it's a great question, and most people, I think, know Nashville for its vibrant music industry, and if you think back to how music was really created, and particularly country music, but there's many other genres of music and studios and musicians that are in Nashville other than country music. But its origin, dates back to maybe 60 plus years ago, where songwriters and musicians and studio tech members collaborated together to either write songs or to do studio work when they weren't on tour. And that grew the ecosystem of support around the music industry. Healthcare is very similar. Its roots were Medicare was legislated in 1965. President Johnson at that time in the United States, less than 10% of the population was 65 or older, which is where Medicare kicks in to provide the financing for health services for seniors. And also Medicaid was legislated, which is a program that's administered by states, but paid for 50% paid for by the federal government. The origin of Nashville is really a great story. A physician, Thomas Frist Sr., had a patient by the name of Jack Massey, a pharmacist from Florida, who had acquired the rights to Kentucky Fried Chicken at the time and had taken that company public and really excelled in venture capital. And then Thomas Frist Sr.'s son, Thomas Frist Jr., was in medical school at the time in the late 60s. And his roommate happened to be the son of a chain of hotels known as Holiday Inns. And Scott, I'm sure you remember when Holiday Inns were present on just about any interstate exit. And the idea really started with, could there be a consolidation of United States hospitals and maybe operated similar to the hospitality industry? And the three of them formed a company called HCA Healthcare that's the largest for-profit provider of health services today. What's happened in Nashville since that time, over 50 years ago, is just many management teams and members, and the ecosystem as it was being built to include legal and facilities and accounting services and clinical operations, et cetera. That ecosystem was being built, and many of the management teams that were at HCA then broke away to found new companies. And now we boast of about 900 healthcare companies are based in Nashville. It's been studied from an economic impact, and it's surprising to most people, but it's about 7 to 10x of what music contributes to the annual economic development of the community. A little bit less than 200,000 people in Nashville and Middle Tennessee work in healthcare. And the companies that tend to be based here, or are headquartered here, generally have operations throughout the United States, and some of those are also global provider organizations as well. We tend to be more health tech and services, maybe differentiated from some other ecosystems around the country as well.
Yeah, you guys you're like a little Silicon Valley of healthcare. I mean, it's like it's amazing what's happened there. And by the way, the Frist you mentioned, I assume, was somehow related to U.S. Senator Bill Frist.
Yes.
Also like doing healthcare investing, I assume. I don't know if that's a Nashville entity also, but like the connections to the healthcare ecosystem broadly are everything kind of spawns from Nashville. Let me ask you a related question, which is we hosted a live stream like this with Justin Graham, who at the time was head of Walmart's digital health like analytics group. And I think when David asked him, what recommendation would you have for startups? He said, Justin said, avoid the major cities. Like, don't go to Silicon Valley, don't go to New York, go to the Midwest of the US and other places where that maybe not get as much attention, and other startups are not focusing there. And I just wonder are you guys kind of beneficiaries of that as well? And like broadly speaking, would you consider, like, if you were a digital health startup sitting in Tel Aviv and you were going to make a recommendation on where to go, would Nashville be at the top of your list above? I mean, you're going to be interested in this. You're going to say yes just because you're in Nashville, but I mean, honestly, is that the kind of a central ecosystem where you would recommend as opposed to somewhere on the coasts?
Yes. Yeah. And I'll tell you a couple of data points on that. I'm a big fan of Steve Case, founder of AOL. He exited that company. President Obama in 2008 asked him to chair a committee on entrepreneurship in the United States. And he came away with a couple of facts that 75% of the venture capital money went to Boston, New York, and San Francisco. The other fact was, if you look at really what's driving employment, it's not the Fortune 1000 companies, and it's not a lot of small businesses that tend to be sort of mom and pop, even though that's where a lot of Americans are employed. It's communities that have an ecosystem, generally around technology, where growth can be accelerated because of that ecosystem. So he set about to study American cities that were outside of those top three, and has visited Nashville many, many times. But because of that ecosystem, I would suggest yes. If an Israeli startup company was in health services and health tech and really wanted to get grounded from the community of people that really understand at a deep personal level how the United States healthcare is financed, how it works from a workflow, what the macro problems are, and then who those companies are solving those problems, Nashville would be my first choice. As you said, I'm extremely biased on that particular answer, but I've seen it repeatedly, time and again. Good growth companies that were founded here leveraged that ecosystem of support to grow what they do nationally and internationally.
And tell what is Project Healthcare? Tell us about that.
Yeah, so Project Healthcare at its core is a 6-month accelerator program. We have 18 companies that are in the cohort now, where this cohort started in January of 2024. It'll wrap up in June. We're about midway. Only 5 of those companies are based here. The other 13 are based around the United States. We have had 2 in recent years, international companies that have joined the program. One was an Israeli company by the name of Bria. Another was a German-based company, Berlin-based company by the name of Darvis. And Darvis actually moved their United States headquarters to Nashville as a result. What we try to do that's a little bit different, so we don't take equity. It's a relatively lightweight fee. It's an application and selection process to get into the program. But what we try to do is really differentiate from other programs. And frankly, there's enough to be done in innovation and healthcare to support all the health services and health tech accelerators around the country, frankly. But how we differentiate a little bit is really focus on building that ecosystem of support. And it might not be your mentor or champion mentor or advisor, but it could be somebody that you met at a networking event or that knows somebody who is on the ground at one of the national players here, and really what founders need to know how to enter the sort of hard to sell into incumbent a group of companies that also exist in Nashville.
So could we actually talk? Can we just dig in there, because that's like the 800-pound gorilla, the big question. I think most healthcare startups on this call, would love to. They want to work with big, large healthcare organizations, but I think a lot find it's really hard to do that. It's really hard to work with the incumbent healthcare players and get them to adopt new technologies. So, why is that so hard for incumbent healthcare institutions to kind of bring new innovations to market? And can you give us kind of what you've seen and what some of the challenges are for some of these bigger players?
Yeah, and I think it's a good question, Scott. And actually, you and I met when I was trying to solve that problem on the other side, which was with a large incumbent organization like AmSurg, and thinking about corporate venturing and standing up a freestanding innovation organization. I'd start with the problems, if you will, in United States healthcare are quite complex. So of the 330 million people, maybe 18% of those are receiving their health benefits from Medicare, maybe another 20% from Medicaid, state systems that if you know about states and their relationship to the federal government, you'll know that there are 50 of them and they're all different. And how they administer their health services programs are radically different from state to state. So if you have a relationship with one state Medicaid organization, you probably have to work hard to build a similar relationship perhaps in an adjacent state. About half the population receives its healthcare financing from employers, and that's going through significant changes. And we still have in this country about 8% of the population that's uninsured. At the macro level, the problems that a lot of the incumbent organizations are trying to face have always lent themselves, in my opinion, to sort of buy or build decisions. And I think now with the pace and the acceleration, the exponential acceleration of what's possible, leveraging cloud compute storage and now AI capabilities, has put a new wrinkle in how incumbent organizations are thinking about innovation. Historically, we had a committee at AmSurg that was about 12 to 15 of us at the senior level, and we would look at new ideas, and sometimes it only took one person, and that might have been somebody in compliance or clinical operations or finance, et cetera, to say no to a solution, or this is not, we're going to invest some time to cut off what maybe the organization thought was a good idea. I think it's also difficult to scale. So a lot of companies that are based in Nashville have historical business scaling models, meaning they get real good, they acquire a lot of other facilities, they reduce their supply costs, they operate more efficiently, they produce margins that allows them the capital to continue to do what they do best, which is scale through acquiring more assets, whether those assets are physical brick and mortar assets or digital and virtual.
Yeah.
And so thinking really hard about how innovation can drive new efficiencies or open adjacent markets is just not where a lot of incumbents spend their time. I think that's changing a little bit. And I'll close on this concept. When I started my career, and I've been at it, 40 plus years, the major stakeholders in healthcare, providers, payers, let's call it government and pharma and life sciences, sort of stayed in their own swim lanes. And they had an ecosystem of support of companies that generally only sold into provider organizations or only sold into payer organizations. Where we are now with the last decade and the emergence of many retailers, companies like CVS and Walgreens and Walmart and Amazon that are providing health services, again, both brick and mortar and virtual, as well as the thousands of digital and virtual first health tech and telehealth companies, is we've moved, in my opinion, from swim lanes to water polo. And so not a clear definition of boundaries, a lot of splashing around, a little friction underneath the surface of the water. The person next to you might be your teammate, could be a competitor, and in some instances, both. So it's almost getting harder to innovate internally. And that's why I think that I'm real high on the programs, the venture studio programs, or some other models that are really partnering with those that are doing the heavy lift on the innovation to gain traction.
So, quick question on something you said earlier about the states and the regulations. Are there states that you think are easier to get into regulation-wise? I'm not talking about just population and location, but actually regulations, where you'd recommend starting.
Yeah, no, good question. I think one thing to look for, and a lot of investors believe this as well, that the United States Medicaid market is a substantial one, about 20% of the population in the United States. So somewhere around close to 70 million Americans are their health insurance is paid for by state Medicaid organizations. They're transitioning fairly rapidly from fee-for-service models, which historically Medicaid has been the lowest unit cost financer of healthcare services. So it was the worst reimbursement for typical healthcare services. But they're transitioning to value-based models where more management of the population and really addressing what many call the social determinants of health or the social drivers of health: food, transportation, housing insecurity, employment, environmental factors. And as those changes occur, there's a lot of opportunity by organizations, early stage companies, to partner with those states that are aggressively moving from typical fee-for-service to manage Medicaid services.
That's interesting. Are there other, if you had to give us some tips or recommendations, for startups who are kind of looking to break through the noise or commercialize, get to market faster, are there other things that you would kind of recommend, to startup stuff that you've seen that works, or, even pitfalls to avoid?
Yeah, I think maybe a couple of things. I've had the fortune now for the last several years to work with many early stage companies through our own Project Healthcare program, as well as others. I serve as a venture partner in 2 digital health funds. I've also, through this process, really taken note of how companies tell their story. And I heard it best actually from a friend who runs a venture fund for a primary care enablement company called Aledade, that he looked for founders that were angry, curious, and good storytellers. And what that means is they identify the problem that needs to be solved at a level that they're just so angry about it, so mad about it, that they've quit their daytime job to form a company to try to fix it. And this next phase is curiosity, which is how do you solve it? And what is the relationship between adjacent organizations or your own suite of services? And then being really good at the storytelling. The companies that I've seen do a really good job with storytelling generally have a quarterly newsletter. It's sort of an open newsletter to investors and maybe friends or partners or suppliers of the company. And that network continues to grow. And what I've observed, it's the randomness of a connection. I've got a friend named Scott who's in Boston who might have an interest in a company that's got a solution targeting, this particular problem in the industry. And the more of those connections that can be made, and the harvesting of that storytelling and the people that have an interest in it is a real talent, first of all, but something that I've seen companies been able to break through. And then finding a champion, and there we talk about it in Nashville. There's sort of two different ways for early stage companies to approach an incumbent. You can approach at the corporate level. That's always going to be harder because they're thinking about your solution not at one place, but across maybe 150. Or you can approach it at the field level. Let's call it the individual, brick and mortar facility or hospital or health system or urgent care clinic. And what's harder about that, it's easier to get in, but sometimes it's harder because of the corporate constraints that are put on those operating units of the solutions that they have to solve. But I've seen it work in both directions. And I would say get to know as many people as you can within that organization who might be adjacent to your product or service, but might sit in the CFO's chair, or might be in supply chain or business operations or clinical operations. And then really, getting their input on the best way to approach an idea, a novel idea, and innovation in one of these incumbent organizations.
Right. That's interesting. Let me ask, I'm going to try to bundle a couple of questions that I just got into one, which is kind of around kind of where the puck is going. I think there's some curiosity about where are incumbents, where's the pain right now? Where are they spending money? Are there certain categories, patient journey, clinical satisfaction, administrative costs, the nursing shortages? Like what's the biggest pain right now where you are finding incumbents are actually spending money and willing to kind of partner and work with startups?
Yeah, great question. And this won't come as a surprise to you from a provider perspective. The number one challenge in the industry in this country and perhaps others around the world is the clinical workforce and the anticipated shortage. So it's the shortage today. It's what we've observed during the last 4 years. It's the desire of a newer generation of those that are clinically trained to want more flexibility in their own lives. And they're making selections of, long-term employment with an industry that right now is going through, a tough time, frankly. So a lot of incumbent organizations are investing a lot in resilience of their workforce. And that starts with companies like HCA that are acquiring and opening new campuses of nursing schools. And they're thinking about the workforce 20 years from now or 25 years from now, to maybe leveraging a lot of the contemporary tools and to build better relationships between the clinical staff members and their mentors and their advisors. And then leveraging AI where it can be leveraged to reduce the burden that's driving so many of the clinical workforce to seek other employment, and frankly, in some other industries. So a lot of traction in all of the complex workflows. Which ones can we offload to machines that would be acceptable to those that are running the businesses, and actually bring a little bit of the joy back to why so many doctors and nurses entered healthcare, which is to spend more time with patients.
And are you seeing, on that note, are you seeing a lot of, robotic process automation and AI solutions aimed at that kind of workforce shortage issue? Or
yeah,
is there still a big opportunity there?
No, I still think there's an enormous opportunity there. The United States has one of the most complex revenue cycles probably on the planet, with all the different payers, federal government, state governments, commercial insurance, co-pays and deductibles, really, really complex set of revenue cycle workflows that have to be in motion in order for somebody to get paid for a service, all bound around state and federal laws and regulations of what's acceptable to bill and what's not acceptable to bill. There is enormous opportunity in that area. In the other area, I just think there's been some great reports and a lot of solid momentum, frankly, on using AI around ambient clinical documentation. In fact, HCA here in Nashville made an investment in a company called Augmetics, ambient clinical documentation. Their first 4 pilots are in the emergency room theater, the most chaotic in terms of documentation of a voice that recognizes, perhaps, Scott, your voice as the doctor and not my voice as the patient, and then takes that documentation in structured format to an electronic health record. And then the other area that I really like is because of the compressed time that clinicians have, whether it's on a virtual call or in person, or other caregivers with a patient today, the ability to leverage tech and AI to produce a pre-visit summary with the meaningful information to allow that clinician to get right to the topic of today's conversation with the patient in an organized way is challenging, frankly, because of the amount of unstructured data that there is in electronic health records today. But bringing that into context within the visit is I've seen gain a lot of traction as well.
Interesting.
Look, question about that, about the AI and since it isn't really regulated yet in terms of regulation too much. How do you stress test that until you're comfortable with it?
Yeah, again, another good question. What I'm observing, there's a lot of frameworks and a lot of coalitions that are forming, generally within the industry, to involve multiple players, and they're almost acting faster than federal government and state governments can act with ways in which AI should be governed. So I would pay attention to those. One here that I'll mention, the Coalition for Health AI, I think they pronounce it CHAI, C-H-A-I, out of the Mayo Clinic, and John Halamka has got a significant board and almost this broad industry participation in developing those frameworks. There's also many other companies, a couple that I'll mention, Class Research, and another company called Elion that is doing some really good work on articulating the variation of the services that are provided by many of the AI first companies that are coming to market. I do a podcast. It's one of the funnest things I get to do these days. I act as the host, so I tell people I'm not a smart guy, but I know a lot of smart people. And I did one out at Vive in LA with the CEO of an Israeli-based company called Navina, and they've got a product that I'm super excited about. The founder, Ronan Lavi, was generous with his time to spend with me. That one will be out for your listeners in just about 3 weeks here, so we're excited to get that one out.
Cool. Hey, look, I know we're past the top of the hour, but can I still throw out 2 more questions?
Please. Yeah.
As long as hopefully the tornado warning has passed. So I have a funny question here, which I know exactly what they mean, which is that the question is, what's wrong with the payers in the US? And I think that for Israeli startups, there's 4 HMOs, and they're all integrated systems. It's like Kaiser. They're the payer and the provider. And US is very different. And I think there's a perception among Israeli startups that the insurance companies in the US, who should be more active and should be more, you'd think that they would be the most kind of innovative and aggressive in terms of cost savings and innovations, are actually perceived to be really slow moving, much more slow moving than some of the providers that we've talked about today. So I'm just curious, have you any perspective on that? Is that your kind of perception also, that the payers in the US are moving slower than the providers are?
Yeah, I would say, maybe a couple of things here. Nashville is you can probably surmise here, is essentially a provider community. And I've spent in my entire career on the provider stakeholder side of the ledger. So I bring certain biases of what I'm about to share with you from through that lens. A lot of the large payers gained a lot of traction when Medicare Part C, also known as Medicare Advantage, which is the value-based Medicare alternative in the United States. And frankly, about 50% of Medicare beneficiaries today are in a Medicare Advantage plan. You would think that they would have the incentives that are necessary to ensure that and promote the health of a population versus just to serve as an insurance company that's got a policy with an individual and it's just paying claims that are submitted by the providers. A lot of the friction exists between the two because of these cumbersome processes that providers have to go through, notably prior authorizations, in order for a particular service to be approved after a doctor has ordered it. The general population just does not understand the complexity. They understand the complexity. They don't understand why that has to be. And I don't see a lot of innovation on the payer side unless the incentives are aligned to promote the health of a population, because they actually do well with fixed amount of payment for services and medical loss ratios. There's some complex formulas here that does not disrupt an existing, business model. And hopefully we're starting to see in this water polo world, and you mentioned Kaiser, but United Health Group through Optum has got a large services delivery. Humana as well, Cigna as well, have acquired and are purchasing provider assets. And at the same time, you're seeing a lot of physician-led organizations really move into risk and take risk for a population and assume some of the delegated responsibility that payers have traditionally had. So I would say keep an eye on that one, and keep an eye on the evolving from fee-for-service to value-based care companies that are also taking risk for a population of people, and therefore promoting and doing better when we all do better with health and prevention versus just paying for services as one becomes more sick.
Right. That's great stuff. Let me ask you one last question, which is, tell us about pitfalls to avoid. Like, what mistakes have you seen kind of digital health startups consistently make? Give us some recommendations for the startups on the call, like things to avoid.
I think it's one that I would always say, and it's one that, my guess is your audience is acutely familiar with. And there's a tendency sometime for startups to lead with their technology. And while we're living in a world where what we know is changing so fast and just, almost doubling every day in what's possible, there's a risk that we're leading with an AI solution without really articulating the problem that one's trying to solve. So I've always felt it best is identification of a problem and an acute understanding of what that problem is, and then moving into how your solution actually contributes to solving that problem is the best way to do it. And the second way I would say is it's been in my career and the way I work with these startups today is leverage your network and build your network with intentionality. And you might say, we have this product and we only sell, or this service and we only sell into this segment within the industry, but you'll quickly become surprised by building that network. You will eventually reach those that are interested in your product or service through a well built out and informed network, sort of back to those quarterly updates and those frequent publications that are your own and that are third parties that are helping you tell that story.
It's great guidance. Love it. So look, I think we're up against it at this point, but so I think I have to call it. But Eric, this was fantastic. Always great to see you, and thanks so much for joining us and sharing some wisdom today.
Yeah, thanks to you both, Scott and David. Thanks to everybody out there.
It was very insightful. Thank you.
Yeah, it's great. So everyone, again, you've been talking to Eric Thraikill, a healthcare executive, digital health investors, and as we heard, the chair of the Nashville Entrepreneur Center's Project Healthcare. Eric said he had some links related to the things we've talked about today. We'll get those links and send them around to everyone who registered. Our next call, just FYI, is going to be with Gene Hahn, who is just an amazing Seattle-based startup advisor, spent nearly 2 decades at Target, driving all their new ventures and their accelerator and a bunch of new business initiatives. Gene has a ton to share on kind of how to scale startups here in the US. So make sure you block that. Same time on May 7th. Again, I'm Scott Cohen from AGP Ventures. On behalf of myself and David Yahid in Israel, thanks to Eric and to LifeSci. Thanks all for joining us, and goodbye.
Thank you. Bye.
Yeah.